Let me go back to the issue of again, opioids, because as I think of those things, those issues that are facing us in Indian country, as facing Alaska Natives, we talk about jobs and workforce development and education, but if we are dealing with a level of addiction that is just debilitating our communities, it makes it really hard to focus on a job. It makes it hard to focus on raising your kids. It makes it hard to focus on education. So again, I mentioned my concerns about what we have in this budget with regards to specifically directed towards the opioid issue. But I want to raise an issue that has come to my attention based on conversations with providers up in the state of Alaska and in Senator Udall's state in New Mexico. And this relates to the Prescription Drug Monitoring Program, PDMP, which is focused specifically on how we can deal with the problem of opioid prescription. And part of it is an issue that if you don't know where an individual has gone before they have come to your facility in trying to access a prescription, then you're operating somewhat blindly. And we now have technologies, we now have the ability to interconnect within our systems to help us be smarter in how we track the prescriptions that are being written. And I think in Alaska, we're a pretty clear example of you have an IHS facility, you've got an emergency room out in the Mat-Su Valley, you've got a clinic, you've got a VA CBOC that's there, and you could literally have an individual going from facility to facility to facility, almost, if you will, kind of venue shopping for prescriptions. So it has come to my attention that within the state of Alaska, we've got the vast majority of hospitals and pharmacies that are participating in this system. They're being able to upload so that a doctor can tell when a patient already has a prescription. I'm told that within the VA, the DOD, and the IHS, there is reluctance to be a participant in what we're seeing in terms of the sharing through the PDMPs. DOD and VA will deal with, I understand that they're coming along, but my information is that IHS has been resistant to participate. And the question is that so? And if so, why? Why would you not view this as a tool to really help those that are struggling with this addiction? So if you can speak to that, Admiral, and tell me where we are and whether you believe that this could be an effective tool to combat opioid abuse.
Thank you, Senator Murkowski. And just off the bat, want to ensure that it's a misnomer that IHS is not supportive of reporting to PDMP and participating in a PDMP. In fact, back as far as 2016, we put in place a prescription drug monitoring program that requires all federal Indian Health Service practitioners to check the PDMP. Dr. Todt has participated in a panel specifically around opioids and can speak very specifically to our work in this area.
Okay.
Thank you for the question, Senator Murkowski. Certainly, IHS shares the concern about the opioid epidemic, and we appreciate all of the support that appropriators have given to IHS for connecting with PDMPs. We have, of our federal pharmacies, 82 of the 83 pharmacies are connected, so we're all but one. And that last one, we have an memorandum that's going through the process in Nebraska to connect our final federal pharmacy. The connections for reporting happen, so the provider gives a prescription to the pharmacy, and the pharmacy reports that data to the state. And we know that in Alaska, our pharmacies are tribal pharmacies, and we have checked with all of the tribes in Alaska, and they are able to connect and report their data to the PDMP. As far as the providers checking the PDMP to see prescriptions from other pharmacies and other providers, again, each of the states has a different access and different ability to do that. So the Alaska PDMP program, any licensed provider in the state of Alaska is able to register. Issues around perhaps individuals having licenses in other states or support staff and what delegations are allowed by what licenses. I think those are the details that need to be worked out. It's not just an IHS issue. It is a broader national issue about access. And also connectivity. So in border states, we know that Four Corners area, where you've got Colorado, Utah, Arizona, New Mexico, that being able to access all of the data conveniently and in one way is extremely important. And it's much bigger than an IHS issue. We don't want to have a silo separate program that looks at our prescriptions, but we entirely support connectivity and appreciate anything that, we will certainly participate and provide any technical assistance if there are additional resources.
Well, I appreciate that, and I would like to understand a little more clearly about how it all intersects, whether it's within Alaska or otherwise. I will just note that there's a couple people that have joined the committee in the audience today, emergency room physicians that are back here at a conference that were able to present to me yesterday, one from New Mexico, one from Alaska. And the information that I have received is a little bit out of sync with what you have outlined. So I would like to just better understand if it's an issue of licensure, if there are things that we can do to, again, reduce these silos, because everything that I have seen leads me to believe that this is one tool, this is one way that we can work cooperatively amongst our agencies, with our providers, with our hospitals, with our pharmacies, to really get at this issue of a prescription oversupply, if you will. So if we can follow up with this and connect you with the folks that we've been talking to, I would greatly appreciate that. Thank you. Thank you.